Okay, good evening. Good evening, everybody. Yes, it's such a pleasure to be here today again. And in the spirit of this, would I say, heart celebration, um, today I'm going to be talking about the heart. I remember my humble self, Lucky. Now, can you see my screen?
Yes, we can.
Okay.
We
So,
are not seeing your slide here too. Your
can you see
presentation.
my slide now?
Yes, it's coming up. Yeah, we can see it now.
Okay, good. Let me hide this and well, should be good to go. So today I'm going to be talking about something a bit different from what um, maybe the other versions have been talking about. But I believe there are, in as much as we are talking about the heart and all, there are one or two things that I feel we should also, some two aspects that I feel we should also look into. And these aspects are also very important, especially with regards to, heart, in the spirit of, this period where we're celebrating the human heart. So, as usual, if I'm a bit fast, please, I'd like you to, just be patient. After the presentation, you can ask one or two questions because I'm going to go a bit deeper than just looking at heart issues. We're going to check one, but we're going to talk about something very briefly that can actually cause cardiovascular issues. And then we're going to talk about some other thing that is caused by cardiovascular issues. And so that's how we're going to go today. And I hope we enjoy this. And if we have any questions as usual, we can ask so that I can answer. Yeah. So now we'll talk about the human heart, but then we're going to talk about the greatest assassins ever. And then we'll talk about cardiovascular diseases, coronary artery disease, or coronary heart disease is going to be what I'm going to single out today. And then something that we take for granted, but it's actually very important that we all know about, and that is how to make someone that whose heart is about to fail to, come back to life. Now, hypertension, we'll talk about hypertension briefly, and then we'll talk about a major risk factor and a major issue as a result of both the risk factor and cardiovascular issues. Now, the human heart, as we all know, is a muscular organ that pumps blood through the blood vessels of the body's circulatory system. It's about the size of a closed fist and is located in between the lungs in the middle part of the chest region. Yes, so now the function of the heart. Its function is to take the oxygenated blood from the body to the lungs and send oxygenated blood from the lungs back to the. In fact, as we all know, one is confirmed clinically dead when the heart stops and there's no breathing and or brain activity. Now, the greatest assassins I'm talking about today are the two things that kill humans the most, which are cholesterol and stress. Cholesterol deposits directly or indirectly account for most cardiovascular issues and leads to what is called ischemia. Ischemia simply means cell death as a result of hindrance of blood flow through the arteries of affected cells, leading to a lack of oxygen and food to the affected cells. That means anything that blocks the inflow of blood, which brings in food and oxygen to the cells, can lead to their death. And when this happens in the heart, you can imagine what happens. Now, stress, on the other hand, leads to production of reactive oxidative species of radicals that attack DNA, which is involved in everything about the human body. Let's remember that our heart is also in our body. So these are just a few of the cardiovascular, just some of the cardiovascular or heart diseases that are available. And then these are ailments that affect the proper function of the heart or blood vessels. They are the leading cause of death in the world and include, coronary artery disease, which is also known as coronary heart disease, as we'll discuss that as shortly, hypertension, which also leads to hypertensive heart disease, as well. Then angina pectoris, which is pain in the chest as a result of blockage of heart blood cells. We'll talk a bit about that. Of course, rheumatoid heart disease, a lot of us don't understand, even know that rheumatism can actually lead to heart diseases. Then cardiomyopathy, which means change in the shape or form of the heart muscles as a result of issues like when the heart is enlarged, you say it's hypertrophic. When the heart is distended as a result of pumping for so long with such very high pressure, can actually make the heart muscles to slack and get distended. Then heart break is another thing people do not believe is one of the problems, and is also known as Takotsubo syndrome, which is sudden enlargement of the heart due to emotional stress and or physical stress. Then we have cardiac arrhythmias, abnormal heartbeats, congestive heart failure, carditis. Then venous thrombosis, that's deep vein thrombosis. That, remember, cardiovascular means both heart and blood vessel issue. But mostly we're talking about the heart today. And these are just a few of the types of cardiovascular diseases that are available. So coronary artery disease, these are often as a result of atherosclerotic plaques of the arteries or blood vessels supplying oxygen to the and food to the heart, which include myocardial infarction, which is just heart muscle death. That's just the translation in Latin. As a result of poor blood supply to the muscles of the heart, we have sudden cardiac death and angina pectoris, which can be stable angina or unstable angina. You see, these are the things that I feel are mostly rampant with regards to heart issues all around us. I'm going to talk about them briefly. So as I said earlier, myocardial infarction simply means heart cell death due to blockage of blood supply. Now, cardiac arrest simply means the heart stopping due to blockage of blood supply to the heart cells. I mean, they've lost their function. They're dead. And that's why they cause a lot of issues. Angina pectoris simply means pain as a result of dying cells of the heart crying in pain. That pain they're crying is what people feel medially in the chest, radiates to the shoulders, the jaw area, the left arm especially, and these things are actually stuff that should be of high consideration, especially in this season. We're talking about the heart. Now, this angina pectoris, which is heart pain, can be stable or unstable. Being stable means is when it's stress-induced. That means anytime the person runs like 100 meters or something, he feels that tightness or that discomfort in the chest. That's the stable angina. But unstable means that it can be spontaneous, it can happen anytime. The person can be lying down reading a novel and start having that issue. And these are often a sign of what? Impending or imminent heart attack. Unfortunately, they are also this is a very powerful libido killer. So one cannot be talking about entanglement performance when they have this kind of issue, because it can actually send the person to the other side. Because if people are about to entangle and they're having this kind of pain in their chest, they can say, oh my God, and they land in front of their God. So, symptoms of coronary artery disease. Coronary artery disease are more prominent in women than women. Congratulations. This is something that I said to some people not too long ago. I was like, men are strong. Yes, we agree we are physically strong. But believe it or not, from what I've been observing, it seems as if women are more internally stronger than men. And imagine that coronary artery disease will, all things being equal, affect a man 10 years before it will affect a woman. And that's something, considering how we men believe that we are, super. But funnily, from the inside, these women are actually stronger than us. Now, part of the signs include shortness of breath, extreme tiredness or fatigue, insomnia, anxiety, irregular heartbeats, dizziness, sweating. Some people just break up in sweat like that all of a sudden. But this burning or pain or pressure in the chest and upper abdomen that radiates to the arm, especially the left arm, jaw, shoulders, etc., is a clear sign of angina pectoris, which is a warning that there's a problem with the blood supply to the heart. As you can see, this guy is holding his chest here. He's already having signs of angina pectoris, and he should seek medical attention urgently. Now, what are the risk factors for coronary artery disease? Yes, hypertension and diabetes. These are tag team members that act via one of the greatest assassins, which is cholesterol, yes. And also in a way, they act through stress because diabetes leads to an increase in reactive oxidative species that damage DNA and ultimately find their way to contributing to problems all over the cardiovascular system. Then we have lack of exercise because the amount of energy you consume in food has to be less than the amount of energy you burn out during an exercise. So your body does not store energy in the form of fat in the system. Of course, obesity is self-explanatory based on what you explained last, because when it's obese, it has a higher risk of having bad cholesterol in the system. And poor dieting leads to obesity, high blood fats as well, or cholesterol directly cause this problem I'm talking about. Genetic predisposition is not an excuse to throw caution to the wind, because what this simply means is that in as much as one has that genetic predisposition to have this issue, it's just like someone that has genetic predisposition to be tall and the person is not eating, brothers and sisters in the Lord, that person is going to be very short. So in what it means is that we have to take care of our heart irrespective of what we conceive as genetic predisposition. And then smoking, believe it or not, smoking a stick of cigarettes a day doubles the risk of cardiovascular issues. Alcoholism directly influences the production of bad cholesterol, aka LDL and VLDL. One of the telltale signs that someone may have coronary artery disease, or one of the risk factors, is having endometriosis below the age of 40, as well as rheumatoid arthritis. Now, this topic is something that people take for granted a lot, but it can actually save one's life, because at every point in time, everyone is just a heartbeat away from death. So we just have to make sure that that last beat, let it be as far as possible. And cardiopulmonary resuscitation will actually help with regards to this. An emergency procedure that involves chest compression and artificial ventilation, that is often mouth to mouth, because I know that this is the part that interests a lot of guys. They go to the swimming pool and hope that a very beautiful lady will drown so that they can assist the lady to get resuscitated by giving the lady the breath of life via mouth to mouth. But that happens in Indian movies. I'm going to explain how this is supposed to be used, and it should be a very serious matter where we have to talk about it. We have to teach ourselves how to do this in such a way that it will be able to save lives. And this is to ensure blood supply to the brain until the heart starts beating again. So it's basically chest compression about 5 to 6 centimeters deep, about 100 to 120 times per minute, and at least about 8 breaths of life through the nose or through the mouth. And we can see that this can actually help to keep the circulation going until the heart peaks again and begins to beat. That's just a brief about cardiopulmonary resuscitation. Maybe one of these days we'll talk more about that. Hypertension, as we already know, is a sustained elevation of blood pressure above normal. This leads to hypertensive heart disease. So I just want to talk briefly about, we're going to talk very briefly about this. And the long and short of the story of hypertension is blood pressure is equal to the rate at which the heart supplies blood to the body, that's cardiac output, times the hindrance to the supply of this blood. Because when there's a hindrance, as we know, the heart will need to compensate for such a hindrance by increasing its blood pressure. And that increase in blood pressure is what ultimately leads to what is called, when it comes sustained, is ultimately hypertension. Now, cardiac output, as aforementioned, is defined here, and peripheral resistance as well is the resistance to blood flow in the system. Cholesterol, as we already know, which is one of the deadliest, the highest assassins or killers of human beings on this earth, is responsible for about 90% of the cases of resistance to blood flow as a result of formation of these plaques here. These plaques hinder blood flow, and the heart has to increase its pressure so that it will ensure that the cells are not denied completely of food and nutrients. So now, essential hypertension is It accounts for about 90 to 95%. This is one of the major types of hypertension. This is a primary hypertension. And 95% of this is as a result, is of cases that have high blood pressure are often what we term essential hypertension. We cannot really point out exactly what is causing it. But guess what? It has been scientifically proven that about 90% of these cases are actually as a result of cholesterol blockade. Well, you can see that this woman has sentenced her unborn child to hypertension by smoking while she's pregnant, as well as lack of poorly breastfed babies often fall into this category of this 95% of essential hypertension. Secondary hypertension is hypertension of known cause. That means if we know the problem and we remove the problem, the hypertension disappears completely. And if, for instance, somebody is having hypertension as a result of monetary issues or poverty, the moment you give the person money, the hypertension disappears, and that shows you that that's secondary hypertension, because the cause goes as the cause moves out, the hypertension disappears, and that's secondary hypertension. It basically accounts for about 5 to 10% of the population. Of course, we know that pregnancy can also induce hypertension, but oftentimes when the woman goes to bed, you find that the BP goes back to normal. Hypertensive crisis is when it seems as if the upper and lower values are actually having a quarrel. Let us remember, and it's worthy of note, that the BP must not be exactly 120/80. It's actually a range of about 100 to 130/80 to 90. And this is actually something that is worthy of note, because some people get worried. They begin to think that they are already dying when they find out that they are having 121/81, and they begin to have high blood pressure on top of a normal blood pressure. And we have other classes of hypertension as well. Now, it's a silent killer. It doesn't have sign or symptom, but if it should just pity you, it can, or pity the person, it can give the person headaches at the back of the head, especially in the morning, lightheadedness, altered vision. We're going to go to this vision we're talking about is one of the things we're going to talk about shortly, that is strongly linked with issues that cause cardiovascular issues. But people don't really look at that angle, because all we're concerned is the heart, but there are other things that can get damaged when cardiovascular issues come on board. I'm going to pick vision mostly as one. So fainting episodes are also signs of very high blood pressure, and such a person should be taken to hospital immediately. This is the only way you can measure blood pressure, by use of a BP machine or sphygmomanometer, as the case may be. Causes and risk factors are basically obesity, smoking, alcoholism, poor dieting, drug abuse, and kidney disease. Let us bear in mind that long unmanaged high blood pressure can actually damage the kidneys. So prevention and management include monitoring blood pressure regularly, avoiding excess salt intake, exercise, weight management, having a healthy Mediterranean diet, quit smoking, of course, reduce alcohol intake that directly increases bad cholesterol level, that's VLDL and LDL, which are very low density lipoprotein and low density lipoprotein respectively. And it also reduces the good cholesterol, which is high density lipoprotein as well. Of course, we have to rest more often. And the use of appropriate medication is also indicated, but this basically helps us to go out of danger. It doesn't mean that, because if there's any chance of hypertension being reversed, tackling these things from that area will help the person to be alive enough for such a problem to be reversed. And the use of supplements as well will also be discussed shortly. This is an example of a Mediterranean diet. I always love showing this picture. It gives an idea of exactly what we should be looking forward to when we are trying to tackle, when we're trying to prevent cardiovascular disease. All things bright and beautiful, as you can see here. If out of 80 million Nigerians, 26.7 million of them are where they have hypertension, The remaining 53.3 million are actually like walking dead. They can drop anytime or sleep and not wake up and believe that somebody in the village that has actually caused the problem. But that's not the truth, because it's actually hypertension that may be causing such loss of lives. Mind you, it has killed more people than COVID since the onset of COVID. But, you know, we thank God that we are still here. Well, complications of hypertension include eye problems. There's what they call hypertensive retinopathy. Now, this is one of the things I was talking about. These cardiovascular issues also have other things that they, precipitate, and we need to be cautious of these things as well. We cannot only just be talking about heart issues, heart, and we forget that these heart issues can actually precipitate some other thing that is very important. And that's why today I'm picking one of those things so we can talk about it, even if it's just for 5 minutes. Of course, it can cause a stroke, cause heart problems, exactly, heart failure, kidney problems, forgetfulness, economic problems as cost of medication and medical bills. I explained to someone how he may be a victim or as one of the people that are swallowing a bucket of tablets every year. When you check these tablets, some people take as many as 15 tablets a day for hypertension, what may have caused the hypertension, and what the hypertension has caused. And by the time you calculate 15 times 365, I bet you if you put it in a small bucket, it may reach up to half a bucket of chemicals being swallowed yearly. But the question is this: where are these chemicals going to? A lot of people find it very difficult to answer this question because, believe it or not, they don't even know. And that's why we have to be very careful with as we swallow chemical medication and try to seek prevention and or management or reversal of these conditions, so we don't have a lot of side effects that are often affiliated or associated with these issues. So hypertension is a major risk factor for cardiovascular diseases and eye health issue. Yes, that's where I'm going to. I just picked the eye as one of the target organs that may end up having, that people that can end up having issues as a result of cardiovascular diseases. Believe it or not, blood vessels supply the eyes, and if the heart is pumping with excess pressure, let's see what will happen. As blood pressure rises, it damages the inner wall of the blood vessels, causing inflammatory reactions that lead to accumulation of cholesterol and other factors in the blood vessels of the heart, leading to cardiovascular complications. That's there on one side. Mind you, this can also happen in the brain and can lead to what? Ischemic, aka cholesterol blockage, stroke. Now, when this damage of blood vessels via hypertension happens in the eyes, then the patient is known to have what is called hypertensive retinopathy. And that is one part of hypertension that people tend to just ignore. They just focus on measure their BP, check their medication, and go, never checking whether it has actually affected a part of their eyes. And so these are just a few of what I call nutraceuticals that can help with this cardiovascular issue. Of course, Arctic Sea contains docosahexaenoic acid and eicosapentaenoic acid, which are essential fatty acids that lead to increase the production of what we call antithrombin that help dissipate cholesterol blockage. I asked the question, when you remove this blockage in the blood vessels and in the heart and all that, you find out that the muscles of the heart get enough perfusion of blood, and then the blood vessel the blood pressure in the body generally goes back to normal. Garlic thyme contains lecithin. It does to cholesterol what HOMO does to engine oil, and also can help us to attack free radicals that affect cells around affected cells in stroke and cardiovascular issues. Aloe vera gel, the uses are numerous, and we'll just talk briefly on this because it has more than 200 naturally occurring nutritious compounds and is a powerful anti-inflammatory agent that can help to hinder the onset or the beginning of that cholesterol blockage, as well as a lot of other things. Coenzyme Q10 is a wonder molecule that helps to rejuvenate and regenerate the heart, the kidney, lungs, and the liver. And the heart, the kidney, the lungs, and the liver are closely interrelated and have a very strong link to blood pressure. And you can, as well, it also brings down blood level of cholesterol. Ag plus contains nitric oxide, that's NO, which is a very potent natural vasodilator, and that will help better perfusion of blood to the heart and better, perfusion of blood all around the body, because the blood vessels go wider and the heart needs less pressure to pump this blood. And it also helps in muscle growth, because L-arginine itself is actually an amino acid, which is the building block of protein. And guess what is made up of protein? Almost everything about you, or you and I, because the muscles are virtually protein fibers, mostly protein. And that's where this comes. So a patient that is losing weight as a result of cachexia, or as a result of chronic disease conditions, like maybe having stroke and maybe this other stuff that happen as a result of cardiovascular issues, you see that such a patient can benefit from this. But guess what? As a bonus to the guys, it also helps, just as it helps blood to perfuse the heart, it also helps with our entanglement apparatus, and that can also help to reverse erectile dysfunction. Now, very briefly, diabetes is also a major risk factor for cardiovascular diseases. So diabetes and eye health issues. So you can see there's a strong link between these three issues: cardiovascular issues, diabetes, and eye health health issues as well. So it's simply a sustained elevated blood sugar level above normal. And this elevation of blood sugar leads to a lot of other complications in the body. Please always target 80 to 100 milligrams per DL. It is not 70 to 125. These are just propaganda of people that are selling sugar to us as soda, so we can continue to swallow sugar without having and throw caution to the wind. Once blood sugar goes above 100, begin to do your dieting, exercise, and use the appropriate nutraceuticals. Don't wait till it gets to 125 or 115. As I see a lot of people, when I check some lab results, I see them writing is 70 to 115. Why do you have to allow yourself to get to the edge of the problem so you fall into the problem? No, it's 80 to 100 milligrams per DL. So that's propaganda, people that are selling Coca-Cola and all those things. Don't listen to them. Stick to 80 to 100 milligrams per DL and make sure that your sugar levels within that, so that you can avoid many complications caused by them, especially cardiovascular issues or heart issues. So controlling blood sugar level is pertinent or important in management of diabetes. Now, listen, diabetes leads to an increase in bad cholesterol levels that leads to cholesterol blockage of blood vessels in the heart and other parts of the body, leading towards cardiovascular diseases. So diabetes directly provokes cardiovascular disease. Now, the other part is diabetic retinopathy. Because the retina of the eyes have no control over how sugar flows from the blood into them. They can get damaged easily when there's too much sugar, and they'll just draw the sugar and damage themselves and lead to poor vision or loss of vision. Also, cholesterol blockage to the blood vessels of the eyes can lead to their damage and also cause poor vision. Now, guess what? Because diabetes leads to production of free radicals that damage DNA, the cells of the retina begin to malfunction. Poorly managed diabetes can also lead to what? Vision loss. So you can see that from the angle of cardiovascular issues, cholesterol, to the angle of DNA damage, stress, those two assassins, and one more other angle, you can see how this is strongly linked to what we are talking about. Well, this is just an explanation of the process by which diabetes can lead towards high blood problem apart from cardiovascular issues and lead to what is called diabetic retinopathy. Yes, examples of nutraceuticals that can help to prevent, because prevention is better than cure. We have fields of greens, which contains chromium picolinate, super greens as well, contains that, aloe gel, aka Bobonishe. Active Pro B, people are wondering what's the connection between the stomach and what we're talking about. When the gut is healthy, our immunity is stronger because there's a strong link between the intestine and our immune system. But just a little digression, there's also a strong link between our intestines and our brain. And that's why we find when people have things like typhoid and all that, they have this splitting headache. That's just on the side anyway. Now, people don't, we bear in mind that calcium and vitamin D are also very strongly linked with regards to glucose-induced secretion of insulin. Nature mean contains chromium and more. Immune blend takes care of the immunologic parts of diabetes that is often neglected. And you can see Ag Plus is here again to do what it knows how to do best, which is dilation of the blood vessels and allow better blood flow. Eye vision is here because it contains something we're going to talk about very soon. B12 plus will reverse the nerve damages as a result of that. Remember that the things that make the heart to beat in a rhythm are actually what we call the pacemaker cells or SA node, atrioventricular node, bundle of His, Purkinje fibers, and all that. These are visually nerves. So when diabetes has damaged those things, you find that a lot of people that have diabetes have irregular heartbeat. There's another strong link between diabetes and cardiovascular issues. Then we have cardio health. Of course, we've spoken about this earlier and how it helps to rejuvenate and regenerate the heart, the lungs, the liver, and the kidneys that are all strongly linked with cardiovascular health and blood pressure. Garlic thyme, as usual, is very essential in regards to clearing the pathway, the blood vessels that supply the pancreas and all that, because it does to cholesterol and all that what OMO does to engine oil. We have B propolis to take care of infections or initial part of stages of diabetic foot, because it's a powerful antimicrobial agent, antiviral, antifungal, antiprotozoa. You have aloe blossom tea to take care of the irritability and sleeplessness associated with diabetes. Royal jelly is fountain of youth, makes us younger and reverses us back to what we're supposed to be, and helps to ease off that, depression that's often associated with diabetes. Multi-marker takes care of the entanglement area, but les men and women also take care of the entanglement area for men and women respectively. Now, weight management is very important because we know that being overweight is strongly linked to cardiovascular issue and poor heart health. And C9 is a combo pack that is specially designed for a 9-day detoxification and weight loss program that systematically helps with weight loss in a matter of days. It even includes a measuring tape for before and after confirmation. Can you imagine that? So weight management involves Garcinia Plus that has hydrochloric acid as well as thermogenesis in TEM and chromium trichloride in Forever Lean. And these are the ways we help to reduce or help in weight management. Now, let's just talk about the eye briefly. So the eyes are basically the windows to the soul. And you can see that cardiovascular issues can, one way or the other, what causes cardiovascular issues too, like diabetes, also damage the eyes. Cardiovascular issues also damage the eye. So let's just talk about the eye briefly. So the human eye is dust, and light goes in through this front part and strikes the part that interprets vision, called the retina. Now, it's the part of the retina is the part of the eye that processes light. I asked a question today somewhere, and I asked someone, I said, do you see with your eyes or do you see with our brains? And then a lot of people said we see with our eyes, but that is wrong. You actually see with your brain. You can be looking at something and you may not even be seeing it. It's only when your brain interprets what goes through the eyes, and that's when one has what is called vision. If somebody likes a lot of food and goes to a wedding and then they're carrying his favorite dish and passing his front, even if the groom is dancing right in front of him and waving at him, he may not see him. Even if the bride comes and is dancing right in front of him, he may not see her because his brain is locked on to what it likes, which is the vision or the observation of food. And that is why you see that you see with your brain. And AKA, I forgot the name of the artist that said, Opolo eyes, no be open eye. That means no matter how big your eyes are, don't mean that you are seeing what is in front of you. The macula is a very sensitive part of the retina that can get easily damaged by cardiovascular diseases. Yes, as well as diabetes. you see, it acts as a sunshade over the sensitive part of the eye and is responsible for that clear vision that we actually have. Now, there are two essential biomolecules that contain, that is lutein and zeaxanthin, that are contained in this macular region. And their color is yellow to help to absorb what? Blue light that can actually damage the eyes or the macular area and lead to what is called macular degeneration. But because it happens as people get older, somehow, when people don't take care of themselves, particularly, it's also termed as age-related macular degeneration. So now, there are just a few. Myopia means short-sightedness when the eyeball is too long. And we have hypermetropia, which is far-sightedness when the eyeball is too short. And then cataracts as well, which decrease in vision as a result of cloudy area in the lens of the eyes. Do we know that there's vitamin C in the eye? God put it there to prevent attack of the eye organ by reactive oxidative species or stress factors. Now, diabetes, trauma, alcoholism, smoking, age, and all that oxidative stress are all responsible, can also be risk factors for this. Glaucoma simply means damage to the eye as a result of increase in eye pressure. But sometimes people can have glaucoma when the eye pressure is still normal. But mostly what causes damage as a result of glaucoma, what causes problems is that when the eye pressure becomes too high, the way the fluid is forming in the eyes is faster than how it is leaving it. And that leads to what? Pressure. And that pressure is exerted on sensitive areas of the eyes, like the part that interprets, that converts light into electrical impulses to be interpreted by the brain as vision, and that is the retina and the macular area. Astigmatic condition where light can form, an object can form more than one, can land on more than one, light from an object can land on more than one part of the retina, leading to, many, just like one person standing in front of you and you're seeing three people. That can cause, and also like blurry vision, that can cause by astigmatism. Well, digital eye strain, basically everybody holding their phone 24/7, we should be cautious because the blue light from these digital devices can lead to what is called macular degeneration. Macular degeneration is the process of damage to the macular region of the retina and is known as age-related macular degeneration. It occurs as one gets older and is characterized by blurred or no vision in central or visual field. And it may also lead to what? Hallucinations. Now, this is what grandpa is supposed to be seeing. Unfortunately, this is what he is seeing. So we can see that this is how someone perceives his grandchildren when they are playing in the backyard. But because cardiovascular diseases have actually damaged the macular region that may have damaged the macular region of the eyes, or as well as diabetes, which also causes cardiovascular issues, grandpa begins to see his grandchildren somewhat like this. The central area of vision is lost as a result of all those stuff. So smoking, genetic predisposition, hypertension, cholesterol, high blood cholesterol, atherosclerosis, obesity, UV rays from the sun, diabetes, and all that are also very strong risk factors. Now, blue light is everywhere and is directly linked to age-related macular degeneration or macular degeneration. LED lights as well are also very strongly linked with this. Now, remember how lutein and zeaxanthin help shade the retina from blue eye. So take note of that lutein and zeaxanthin, as it's very important. These are sources of LED light, our TVs, our phones, laptop, rechargeable lamps, billboards, electric light, and so on and so forth. The complications include, as aforementioned, macular degeneration, altered sleep cycle, nearsightedness in children, and what is called digital eye strain. So the challenges include poor health information, poor health infrastructure, because a lot of people don't even know that staring at the screen for so long can damage the eyes. Poor health infrastructure, nowhere to diagnose where this damage has taken place. Self-medications have been used when somebody is having problems, so to go and consult maybe an ophthalmologist or even an optometrist to check certain parameters. The person is carrying one thing or the other and throwing inside their eye or swallowing, and without consulting anybody that is an authority in health. That is also one of the problems. Lack of adequate health assurance, japa.com. People are traveling out. I mean, people that are traveling abroad these days are writing exams before they go out. So many of the ones that are behind, they failed their exams. So it's only God that will help us. Yes. So among us that are health practitioners, we still have a lot of people that could not make it to travel out. And those ones can actually cause a lot of damage because they can give you what you're not supposed to take because their mind is on how to write the exam again and leave. Economic challenges, yes, people think about this, the cost of, in fact, just cost of transportation to go to the eye clinic can discourage somebody from going to check. Poor parental control, children watching TV up to 2 a.m., 3 a.m. in the morning, they wake up again by 6 to start preparing to go to school is a no. Poor dietary habits leads to, because it leads to a lot of stuff. I'll tell us why shortly, and a sedentary lifestyle can also. Now, based still on all things bright and beautiful, you can see these carrots here actually good for the eyes. They contain carotenoids, and the first thing they do for you is to prevent night blindness. And what you can, okay, screen time management, regular eye exam, proper diet, exercise, and bear in mind that the 20-20-20 rule is important. Stay close for 20 minutes, stay at least 20 feet away for about 20 seconds to preserve eye health, and use of supplements as well. Now, these supplements help to attack free radicals, regulate blood pressure that can, remember, cardiovascular diseases lead to eye problems as well. Weight management leads to cardiovascular diseases when it's poor. And then they also help us in managing the eye conditions directly. Then they help to regulate blood cholesterol that leads to cardiovascular diseases that can also lead to eye problems. And then prevent cholesterol blockage of blood vessels that can damage the eyes directly as well. And of course, arrest macular degeneration. So let's just quickly talk about this product, which is very wonderful. You see, we're talking about lutein and zeaxanthin being essential for the very sensitive part of the eye that gets damaged, especially when people have cardiovascular diseases. And you can see that Forever Eye Vision contains this lutein and zeaxanthin in very high quantity. That is why when I give this product to patients that are already having issues like diabetic retinopathy, especially the early stages, believe it or not, I've had wonderful testimony of this issue reversing. In fact, a patient's daughter just registered yesterday and she ordered for more products because her mother was having certain eye issues. And I told her the truth. I said there are two ways to tackle this thing. It's either you swallow chemical drugs and you help the scientific industry or the medical or pharmaceutical industry, because you keep coming back to refill, you feel okay, if it gets worse, but you may need higher and higher doses until the system cannot take it anymore, or you patiently use substances alongside these chemical medication, and then they work silently under and begin to arrange the foundation of the problem. Because my own style of attending to patients may be different from another person's style. Mine starts from what is called why or what. What caused the problem? That's where I start from. But different people have different styles of arrangement. You may come to me and say you're having headache. I may ask you certain questions like, have you eaten today? If you say no, did you eat yesterday? And you say no, I may tell you, my brother and sister in the Lord, you have to go to a fast food or anywhere to go and eat. Before you finish your food up to halfway, you call me on the phone and tell me that you are no longer having the headache. I will shout praise the Lord with you. But some other person may come to you, go to the office, they take a shovel and throw paracetamol inside your mouth and shout next, and people are different. So when you use lutein and zeaxanthin that are found in Forever Eye Vision, it can solve the problem from the foundation of the issue and give a better outcome over time. Remember, you don't have to stop or alter your prescription from your ophthalmologist or wherever you are coming from, your doctor or your pharmacy or your nurse or whatever, whoever is your healthcare giver. You don't have to do that without adequate consultation, because they will begin to reduce whatever chemical drugs they are taking on their own as they observe that you are getting better. So let's bear that in mind. But these natural substances actually help to solve this problem from the root. And this applies to many other disease conditions that we have discussed before. And then it contains zinc for immunity, contains vitamin C. Remember I said vitamin C is essential in the eyes. And of course, vitamin E, aloe gel has a lot of things to offer. And its cousin there, bits and peaches, contains antioxidants and carotenoids that are very good for the eyes and prevent night blindness and a lot of other issues. Absorbent C. This is not the regular vitamin C people find on the streets. Our bodies absorb ascorbate better. Just as our bodies absorb folate better, when you take folic acid, it's a synthetic form of folate, and of course, it will deposit a lot of substances as time goes on. But ascorbate, unlike ascorbic acid, we don't even know what is inside all of these things. We just believe God that at least let 20% of the ascorbate be there, or let our body absorb up to 20% of what we are searching for. This ascorbate is found in what's what you find in your orange. That's what we find in orange, and that is what is contained in this absorbency. That's why when people take this absorbency, they have remarkable improvements in whatever condition led them to take it. And it's also very good for the heart with regards to not allowing DNA damage, because these antioxidants attack free radicals that damage DNA. Now, the others include other factors that can actually lead to issues, and they can be addressed with other nutraceuticals or natural pharmaceuticals and all that. So without much, I hope I didn't take too much time. And I always want to add this at the end. You are what you consume, and there's a constant battle between factors that repair and protect our bodies and those that break it down, including our hearts. That means there are a lot of there are factors that are constantly, the heart is steadily working. There are factors that help to repair and protect the heart, and there are factors that help to break it down, like one of the major assassins, the two assassins I talked about earlier, that is cholesterol and stress. So we should always try to be on the winning side. Thank you very much. You can ask whatever questions we have now. Hello. So, do we have any questions? Let's see. Okay. So if we have any questions, we can ask and we shall answer. Okay, someone says, we see with our brain. Yes, we see with our brain actually. And that is what we may not, yes. Okay. So what will you recommend for someone that has cataracts? Let's start from one of the ways that cataracts form. Cataracts simply means things are precipitating out of the clear fluid in the eyes. And the first thing we need to do is to ask ourselves, what are the things that can lead to such precipitation? And that's when you have excess sugar in the blood, for example. And you can see that the excess sugar is, when you turn sugar inside water and you turn it very fast, when you stop turning and the sugar disappears, just wait for some time. You see that some of them begin to come out of the solution, and that is how those cloudy materials begin to precipitate out. And you also know that vitamin C is essential in the eye. God put it there to prevent free radicals from damaging the eyes, and that's also very, very important as well. Yes. So I think there's no other question. So when we use, so of course we use antioxidants, powerful antioxidants, and use adaptogens like, aloe vera gel or aloe and peaches. We use powerful antioxidants. And of course we take, those antioxidants also found in eye vision as well. Of course, we take a lot of absorbent C, a lot of lycium plus and all that. And you can see that that will help with the eyes. How do we get this medication that helps the eyes which are affected by pressure? Okay, get in touch with who invited you, and the person will know how to get in touch with us, and we'll send it to you. Thank you very much. Is there another question? So, in the absence of any question, I'll say thank you, everybody, for being so patient in regards to this different style of presentation. And I really, really appreciate us all.